Every day, millions of people rely on common medications, trusting that they're making the safest choices for their health. But what if some of those very medications are quietly increasing your risk of a heart attack without you ever realizing it? The truth is, even drugs that are widely prescribed or available over the counter can carry hidden dangers for your cardiovascular system. Knowing what to look out for and how these risks arise isn't just important, it could be life-saving. Let's uncover 6 everyday medications that could be putting your heart at risk and learn what you can do to protect yourself and those you love. Let's begin with hormonal contraceptives. They've revolutionized the lives of countless women, offering the freedom to plan families and take charge of reproductive health. But behind their widespread use lies a lesser-known story. These medications, especially those containing both estrogen and progestin, can significantly elevate the risk of serious cardiovascular events. Studies involving millions of women have shown that those using combined hormonal contraceptives, such as pills, patches, or vaginal rings, face a 2-fold increased risk of heart attacks and ischemic strokes. The numbers may sound small at first glance: 1 extra stroke per 4,760 women and 1 extra heart attack per 10,000 each year. But when multiplied across entire populations, the impact is substantial. The risk is even higher with non-oral contraceptives like vaginal rings, which have been linked to nearly a 4-fold increase in heart attack rates. What causes this heightened risk? The answer lies in how estrogen affects the body's natural clotting mechanisms. Estrogen increases the production of clotting factors, tipping the balance toward a state where dangerous blood clots can form more easily. This risk is especially pronounced in women who smoke, have high blood pressure, or elevated cholesterol. Fortunately, not all contraceptives carry the same danger. Progestin-only options, such as certain pills, injections, implants, and especially intrauterine devices, IUDs, generally have a much lower cardiovascular risk profile. In fact, the progestin-only IUD showed no increase in heart attack or stroke risk, making it an important alternative for women concerned about their heart health. Next, consider the painkillers you might reach for when you have a headache, muscle ache, or fever. Non-steroidal anti-inflammatory drugs, or NSAIDs. Medications like ibuprofen and naproxen are household staples, yet their safety profile isn't as benign as many believe. NSAIDs work by blocking enzymes called COX-1 and COX-2, which play key roles in inflammation, but also help maintain the balance in blood flow and clotting. By interfering with these enzymes, NSAIDs can disturb this delicate equilibrium, increasing the likelihood of blood clots and, in turn, heart attacks and strokes. Alarmingly, research shows that this risk can appear within just a few weeks of starting NSAID therapy and rises with higher doses and longer use. It's not just prescription-strength NSAIDs that pose a threat. Even over-the-counter varieties can be harmful if used carelessly. Among all NSAIDs, diclofenac stands out for its especially high risk of major vascular events, while naproxen seems to have a somewhat safer profile. The bottom line, NSAIDs should always be used at the lowest effective dose, for the shortest necessary duration, and only after considering your individual heart risk. If you have a history of heart disease, it's crucial to discuss alternative pain relief options with your healthcare provider. Our third group of concern is a class of diabetes medications called thiazolidinediones, with rosiglitazone being one of the most well-known examples. Designed to improve insulin sensitivity and help people with type 2 diabetes control their blood sugar, these drugs seemed promising at first. But over time, mounting evidence has shown that rosiglitazone, in particular, carries a significant risk for the heart. A major analysis published in the New England Journal of Medicine found a 43% increased risk of heart attack among users of this medication. Other studies have linked it to a higher chance of developing heart failure, a condition where the heart struggles to pump blood efficiently. The controversy around rosiglitazone highlights the importance of balancing the benefits of blood sugar control with the potential for harm. For many patients, safer alternatives exist, especially for those who already face cardiovascular risks. If you're managing diabetes, it's essential to have an open conversation with your healthcare provider about the pros and cons of every medication. Antidepressants are next on our list, specifically tricyclic antidepressants, TCAs, and certain selective serotonin reuptake inhibitors, SSRIs. TCAs, such as amitriptyline and nortriptyline, are known for their effectiveness in treating depression, but they also affect the heart in several ways. They can lower blood pressure when you stand up, causing dizziness and increasing the risk of falls. More worryingly, TCAs can alter the heart's electrical signaling, increasing the risk of dangerous arrhythmias, abnormal heart rhythms that can be life-threatening. These risks are highest in people with existing heart disease, and as a result, TCAs are often avoided in this group. SSRIs, a newer class of antidepressants, tend to be safer for the heart, but they aren't risk-free. Drugs like citalopram and escitalopram can cause a lengthening of the heart's QT interval, which, in rare cases, may lead to a serious arrhythmia known as torsades de pointes. The risk increases with higher doses, prompting health authorities to recommend strict dose limits. Even so, SSRIs are usually the first choice for treating depression in people with known heart disease, but doctors must always weigh the risks and monitor for side effects. Pseudoephedrine is a medication you may have taken for a stuffy nose, but its effects go far beyond simple congestion relief. As a decongestant found in many cold and allergy remedies, pseudoephedrine constricts blood vessels to reduce swelling in the nose. However, this same action can raise blood pressure and heart rate throughout the body. In people with hypertension or heart rhythm problems, pseudoephedrine can trigger dangerous spikes in blood pressure, rapid heartbeat, and even heart attacks. It may also interact with other medications, intensifying cardiovascular side effects. For those with heart concerns, it's best to seek alternatives and always consult with a healthcare provider before using products containing pseudoephedrine. Finally, it's important to remember that even medications not covered in this discussion can have unexpected effects on the heart, especially when combined with other drugs or used in people with underlying health issues. The key to safeguarding your heart is staying informed, communicating openly with your healthcare team, and regularly reviewing all your medications, prescription or over-the-counter. By understanding these hidden risks and making informed choices, you take a powerful step toward preserving your heart health. Share what you've learned with friends and family, and never hesitate to ask questions or seek second opinions about your medications. Stay curious, stay proactive, and above all, stay healthy.